Hello, everyone, and welcome to today's Women's Health Tech Wednesday. I am your host for today. My name is Ansley Bowen. I'm a Community Development Manager here at HitLab. And before we get started with our guest for today, I have a couple of quick announcements for you all. We have our Versely Innovation Challenge tomorrow. Three finalists are going to be presenting for a total of $50,000 in prize money. These startups are all in the menopause and women's health space. It's going to be a super exciting event to attend. And also we have a special prize for our audience members as well. We're doing an exclusive giveaway where you have the chance to win a $100 Amazon gift card. So if you're interested in attending and hopefully winning a gift card, make sure you register for our event tomorrow and join us. I also want to let everyone know that HitLab is thrilled to partner with Myri. It's an innovative health tech company to conduct a qualitative research study to help uncover unmet needs in rare disease caregiving and data collection. So your voice can actually help shape this transformative solution. If you're a researcher, executive, or decision maker in a rare disease organization, we'd love your input. For more information, please visit the links in the chat. I also want to remind everyone that we have our summit coming up in Times Square in just a couple of weeks, December 2nd through the 4th. It's going to be a 3-day conference packed with a lot of networking, really great speakers, and it's just going to be a really great experience overall. So if you're interested in attending, please do also check out the links in the chat. And finally, I want to let everyone know about our HitLab Fireside Chat we have coming up with Addie Diner, co-founder and CEO of iFocus Health, a previous Breakthrough Alliance Challenge winner. And this is for members only for our Breakthrough Alliance Fellowship program. So if you're interested in learning more, signing up for this event, also please check out the chat. And without further ado, I would love to welcome our guest, Dr. Pinkey Patel, who is the CEO and co-founder of Myri Health. She was actually also a previous Women's Health Tech Challenge winner. We're going to talk a little bit about that today. But Dr. Pinkey, it would be great if you could introduce yourself to the audience, and then we'll get started.
Hello, thank you for having me. I'm Dr. Pinkey Patel, the CEO and founder of Myri Health. Myri Health is an AI-powered platform, SaaS and app platform that prevents and predicts complications in maternal care and postpartum before they happen. Our goal is to improve maternal mortality, improve birthing outcomes, and really provide a comprehensive evidence-based platform for mothers and providers.
Amazing. And thank you so much for taking your time out to be here today. And again, I want to congratulate you again on winning first place series pre-seed at the HitLab's Women's Health Tech Challenge. Can you share your personal journey that led you to find Myri Health, and also what inspired you to focus on maternal health?
So I'm actually a pharmacist by trade. I worked for United Healthcare for 13 years, and I'm also a pre and postnatal corrective exercise specialist. All of those things sort of collided when I had my baby that I didn't know. I always laughed and said that I would have laughed if you asked me if I was going to be an entrepreneur 10 years ago. But my experiences in maternal care led me to building Myri. And Myri was something that was built that was actually, I launched it 3 weeks before delivering my son in 2019. And I don't recommend that, but it was launched in beta. And I guess you just kind of jump off the cliff and build your chute down is kind of how the journey was. So that's how Myri started. And the entire inspiration behind it was the fact that, I had my daughter, she's now 8, and my experiences in maternal care, I did all the homework. I had a doula. I watched birthing as a business. I dotted my I's, crossed my T's, and I still had a 60-hour unmedicated labor. They tried to augment my care for convenience. So they basically said, let's just tell her her baby's in distress, give her a C-section, get her out of here. Actual words. And I was like, wait a minute. At hour 58, I decided that I was going to ask for the data, and I had my baby just fine. We didn't need an emergency C-section. So that was one thing that ruffled my feathers, if you will, in pregnancy, that made me wonder, wait, if this happens to me, like this might happen to a lot of other women. And then the other piece was in postpartum, which is how we started. Myri was actually postpartum first. And having one appointment at 6 weeks, that was an average of 11 minutes long to clear me for everything under the sun, from physical therapy that wasn't even talked about to mental health, really made me question a lot of things. So that was where the inspiration came from. I'm also an influencer. I have a large following on Instagram because I was very authentic in my story of talking about my experiences in motherhood. And that kind of further validated why I was building what I was building.
Absolutely. I mean, that is just incredible that you were able to take your own personal experience there and realize, if it's happening to me, it's probably happening to many, many others, and then doing something to actively change that. My next question was actually going to be, what are some of the key moments and experiences in your life that have also helped shape your passion for improving women's health, particularly in maternal health? You kind of answered that already, but is there anything additional to add to that?
I think the other piece was just saying, when you finally pull the trigger and you go, I'm going to go full time and I'm going to go for this and take the risk. One of those things that was really defining was that when I was putting myself out there on social media and telling my story, I built a consultancy before I built the company. And that was to understand, do my comprehensive market research and really understand pain points of other women. And so the thing that kept saying, you can't turn your back on this, you have to keep going forward, was the stories from other women. And so I think that also said, me too, me too, me too. And it was like, at the beginning, you always say, oh, it's just happening to me. Maybe I'm making it up in my head. And I think a lot of us do that, whether it's menopause or perimenopause or whatever we go through in our reproductive journey. But those were also very pivotal moments.
Absolutely. And also as a founder, what are some of the most challenging moments you've faced so far? And also, how did you overcome them?
As a founder and a perfectionist by trade, so I always joke like I'm a pharmacist by trade. So 1 + 1 = 2. It does not equal 3. And as an entrepreneur, it sometimes equals 3. And so having to get rid of that a bit like need for perfectionism
Yeah.
was one of my personal struggles. So when I launched the beta and it was an app on the D2C, it was a D2C app on the Apple and Google Play Store. They were paying, there was a subscription model at the time. We had 44 paying countries and over 6 figures in revenue. And I was like, wait, so maybe I'm not so crazy. It wasn't so perfect. And but it was kind of like, let go and let God. And this is your first iteration. It's only going to get better from here.
Mhm.
And that was something that I struggled with. And then the other thing was learning that the ability to pivot, the velocity at which your ability to pivot is everything, and not just sitting there and going, oh, it's not working. It's not working. You just have to understand that, okay, it's not working. You need to move. And so those were
Yeah.
challenges that we had to going from D2C to B2B and then refining our B2B model. Like those were challenges that I experienced.
Absolutely. And on that topic too, what motivates you to keep pushing forward in this space, especially given the complexities and the challenges, especially when you are combining AI with healthcare?
Yeah, I think the motivation is the why, right? So the why
Mhm.
never changes. And you have to think about that moment when I was in my rocking chair going, wait, I have a phone in my hand and I have a baby in one hand, and I'm literally going down a rabbit hole in Google and probably diagnosing myself with a tumor. And so it's like, if I'm doing this, then like, why are we not leveraging technology for 50% of the
Mhm.
population that is birthing 100% of the population while we're working on all these other technologies? Like, we should prioritize motherhood, because if the mom is not thriving, nobody's thriving. And so I
Right.
think that is my biggest motivation, is that if you want to check on the health of a community, you have to check on the health of the mom and how do we improve that mother's health.
Yes, absolutely. And also, you mentioned before, how kind of like 1 + 1 doesn't always equal 3, but sometimes it does. So, how does your background or your previous experiences actually did help to influence your approach to building the solution for maternal care?
So my background is in pharmacy, yes, but I'm also a personal trainer that specializes in pre and
Mm.
postnatal corrective exercise. And so it started postpartum first, but it also had an emphasis on physical therapy. And it started with the question of PT is not a standard of care here. Like a lot
Mhm.
of women don't know, hey, but my pelvic floor. Pelvic floor is a very important
Right.
muscle, right? It actually holds your uterus and a lot of other organs. And then why don't we have recovery that is standardized for that? And so my expertise really lied in that space. But the other piece of this is um, being able to, support myself with others that are like strengths in this space, right? That are,
Mhm.
having a team that is actually stronger in some aspects that I'm not in, potentially, like in technology, right? So, but I feel like my background from whatever I've had is, whether it's pharmacy, pre and postnatal corrective exercise, my lived experiences, and then combining
Mhm.
it with a team that is stronger in the digital space, I think that is truly like moving the needle with what Myri is doing. But some other aspects of my background is that have to do with entrepreneurship, but not actually digital health, is I also
Mhm.
did bodybuilding. And
Oh,
so
wow.
things that I learned in bodybuilding, it's funny, full circle. I never thought that it would come back, but it's like you basically, when you do something like a bodybuilding competition, you eat the
Mhm.
food, you train, nobody's clapping for you. It sucks sometimes. You have to have discipline. all of those things have resonated in entrepreneurship because it is very, very lonely. And so
Mhm.
it's kind of parallel in terms of the journey that I'm experiencing right now because I've sat by myself on a computer and wondered, oh my God, this really sucks, but I have to just get this done, or it's not always pretty. And so that part of my life has kind of come back full circle.
Well, I love to hear that you have such a vast, enormous amount of experience in kind of like all the different realms, but it comes together to really help with your entrepreneurship. I love hearing, people's backgrounds and stories, and to know that you were in bodybuilding is I just complete respect for you on that, and because I know it is not easy at all going through what you go through to
Not
get to
doing it
that
now because
goal.
we have a startup, so we can't do a startup and body and have two children
No,
right
you
now.
still did that. That's an amazing accomplishment to do that. I mean, I would love to one day. We'll see. But also, I want to talk more about the AI portion too. So, what specific role does AI also play into your platform, and
Yeah.
how does it help detect the risk or prevent complications with maternal care?
Yeah, that was a recent inclusion. So whenever we did Google for Startups earlier this year, and that really allowed us to leverage the resources that we had with Google as well. And so AI now plays a crucial role because we're powering personalization and early detection in maternal care, as you mentioned. So we're using AI-driven algorithm to analyze data from various sources. So
Mhm.
self-reported symptoms, health history, biometric data that's allowing us to identify trends and risks that might otherwise go noticed. So, for example, detecting signs of preterm labor or mental health challenges to get the mom the care that she needs. So,
Mhm.
we can connect with wearables, various apps. We also have the ability to connect with various EHRs. They can take a picture of their lab reports. All of that gets
Wow.
analyzed, and we perform data analytics on that and then provide personalized care plans. But it's not really just about the tech either, right? It's like making it accessible,
Yeah.
proactive, not being more preventative, not reactive, equitable, and especially for moms, even like in underserved and rural areas. So really
Right.
tailoring that intervention and providing actionable insights and then empowering not only the mom, but we also have the
Mhm.
ability to empower a care provider to prevent a complication before it happens.
Wow. Yeah, and since this AI integration is new, what is the biggest challenge that you've had, especially when you're navigating through the variety of the other challenges that you're facing?
Yeah, so with integrating with AI in healthcare, like especially with maternal care, it's
Mhm.
trust. And
Yeah.
moms need to trust the platform to guide them accurately, and providers need to trust the technology to complement, not replace their expertise, right?
Mhm.
So it's deeply personal. Maternal health is deeply personal, and any misstep can feel amplified. And so to that variability in data quality, interoperability in existing systems, and addressing the biases in AI
Mhm.
models, you have a complex landscape for to
Right.
navigate, right? And so we're tackling this by being laser focused on being transparent and inclusive. And so our AI is designed with clinical oversight, and we're ensuring that recommendations are evidence-based and validated. So we also want to prioritize working with diverse data sets. So
Yeah.
we're minimizing the bias and ensuring that it's working for moms across many demographics. And on
Mhm.
the integration front, we're making our platform more interoperable with existing health systems and want to make it flexible for use in rural and resource limited settings as well. And at the end of the day, we never want to lose sight of the human connection. So
Right.
AI is a tool to enhance care, not to replace it. So we really
Yeah.
want to lean on an empathetic design and education to build that trust. Because when
Mhm.
moms and providers both feel confident using the tech, it's actually a game changer for outcomes.
Yeah, absolutely. What you mentioned so true with that trust portion. As long as you kind of keep that as your sole like basis for this,
Yeah.
using the AI can really be a tool. And I think that's what a lot of people sometimes struggle to see because we think of AI can kind of take over a little bit, make it seem not as personable. But as
Yeah.
long as you still have that piece, that's amazing. And AI can be a really great tool for helping and really leveraging the technology. But with any new tech that may occur, you always have to deal with potential accuracy or reliability issues. So have you ever occurred any of that with the AI driven assessments, especially like you said, in a field as sensitive as maternal health?
Yeah, so like I said earlier, this is a pretty new integration
Mhm.
as earlier this year in terms of the AI piece. And as we're working and testing this, we really prioritize ensuring accuracy and reliability in a field as sensitive as maternal health. We're wanting to achieve this through a combination of clinical rigor, continuous improvement, and
Mhm.
user-centric design. So being able to design our AI algorithms on evidence-based guidelines and validating that data. So we're partnering with experts, including OBGYNs, maternal
Mhm.
health experts, pelvic floor therapists are on our board to ensure that these recommendations are aligning with the latest research and best practices. And as we're testing it with we're identifying potential research partners. This is also a priority we've echoed to them. But we're also using diverse data sets to train our AI. So we want to, like I said, reduce that bias and improve its applicability to moms of different demographics and health
Mhm.
backgrounds. Because we are global. Actually, we were in Riyadh, Saudi Arabia last week. We were chosen as
Wow.
the top 100 companies in the entire world out of 16,000. We were invited to pitch and also potentially explore opportunities there. And so when we
Wow.
talk about different demographics, it's we're validating that we are truly a global solution, because we know that maternal health care outcomes can vary widely across populations. So
Yeah.
want to be sure to address those disparities and to build a reliable tech. And then we take a feedback loop approach. Our
Mhm.
platform learns and improves from every interaction, and we want to regularly audit that AI performance against real world outcomes so that we ensure that the tech adapts to evolving needs and stays ahead of those gaps. And then again, we want to be very transparent with how this works. So why
Yeah.
is it flagging this? And what is it flagging? So really building back on that trust with the provider and the user as well, and prioritizing human oversight.
And you mentioned earlier too about how it's so important, especially in underserved communities or areas even with limited healthcare access. So, how does your technology help to reduce, maternal mortality or morbidity rates in those underserved areas
So
as
we
well?
actually started, I'm in Oklahoma. I'm in the middle of the country, and we actually did a lot of work in Kansas. We're starting to do some work in Arkansas and Mississippi. So there are rural deserts, is what they call them. They're
Mhm.
actually in other places where that rather just not only in the middle of the country. And so we want to, when you talk about reducing maternal mortality and morbidity, particularly in underserved communities, that's actually at the heart of our mission. It's where we kind of started. Our technology will tries to bridge the gap in care by meeting the mom where she is, right? Whether she's,
Right.
one of the first counties we worked with, they were had some of the worst maternal mortalities in Kansas, and that was actually Kansas has one of the worst, so it was even worse than
Oh,
that.
wow.
So we were able to, quantify and see what we were driving in terms of outcomes from them, because they were about 2.5 hours from the largest hospital. And so we were able to pull those outcomes and see that, okay, this mom, if she didn't have a Myri, then she would otherwise have not been seen, or some postpartum issues may not have been identified. So
Right.
whether it's in a maternity care desert or a rural area or even an underserved urban community, those are common as well. But first, our platform is providing that proactive support. So we're identifying the risk early. So for example, even if you're analyzing at the very least a self-reported symptom, a health history, if they don't have a wearable at all, right? Maybe they have an Apple phone. But we can flag warning signs of complications like preeclampsia, gestational diabetes, and preterm labor before they can escalate. So that is the early detection piece. And then that accessibility is number two, where you can access the platform from a phone anytime, anywhere. You're
Mhm.
removing the barrier of geography and transportation, which is often the issue when you're in an underserved area. And then when it comes down to limited healthcare access in general, maybe we can connect them to a virtual care option or an educational
Mhm.
resource or a step-by-step guidance tailored to specific to their needs. And then helping the provider on the flip side in that underserved area prioritize resources and give them actionable insights, because a lot of these underserved areas and rural deserts they're getting rid of some of these facilities. That's the truth.
Oh,
They,
wow.
there's less clinics that are open, less hospitals that are open. This is common in Alabama. This has also happened in Mississippi. So being able to say, okay, we don't have the staff to serve all of these mothers, but let's give them actionable insights and reduce their workload with
Mhm.
accurate data. So instead of showing up and presenting to a clinic in an ER, they can intervene sooner, and they're armed with data and predictive tools from our platform. So at that point, we're still building that equity, improving outcomes, because we really do feel like no mom should be left behind no matter where she lives.
Absolutely. Absolutely. And that's amazing that you are really focusing on those areas specifically because they are really the areas that need it the most. I mean, 2.5 hours away from a hospital.
Yeah.
I mean, for me who lives in a definitely not a rural area, I can't even imagine that. I mean, it's like right down the street. I can see it from my window.
Yeah.
So to have that, such that big gap, we really do need to address those. And again, thank you so much for focusing on that, because it is super important. It's amazing the work that you're doing with that. And also I wanted to know if you have any success stories or examples of how your technology has directly impacted the health of mothers or improved their experiences during pregnancy.
Yeah, so when I talked about the Kansas incident, right,
Mhm.
where those were our first kind of experiences and opportunities were those counties. And we were invited by the Blue Cross Blue Shield Initiative in Kansas through like this Nexus Community Challenge, and really had to go in and learn like what were their pain points, where do
Mhm.
they live, what do they have access to, and that was our first kind of integration with some of these counties. And we were able to utilize, well, we had an experience of over 18 months with them, and we were able to identify from a retrospectively what we were able to identify in terms of outcomes, right? So what was their postpartum mortality like? How are we supporting their maternal mental health, even if it was surveys, right? We
Yeah.
were collecting data from our platform. At that time, it was only postpartum, it wasn't pregnancy. So this success story is actually for postpartum. But what interventions were made? When were they contacting their provider versus where they wouldn't have contacted their provider because they were getting feedback from the platform, right? So
Mhm.
in our platform, every 2 weeks, let's say, it'll ask you even mental and physical health questions. For example, physical health, if it says, do you have a swollen neck vein? That means you could have postpartum cardiomyopathy. You might just think
Mhm.
it's a swollen neck vein, right? You're like, I'm
Right.
bloated, I'm swollen, I'm postpartum, whatever. But it'll say the call to actions are different depending on how we're engaging with the community. And the
Mhm.
call to action there was just call your doctor. And so the
Right.
amount of inbound that was happening, and we can track all those things within the application, that was very positive to see that they were embarking on what we were kind of suggesting in terms of even mental health. At 6 weeks postpartum, you get a sheet of paper and it asks you about your mental health questions. And I
Mhm.
lied on it. I was like, sure, no, I don't cry. No, I'm not sad. Everything's great. Because I was like, I don't have time for this. Here's your paper.
Right.
I'm out. Right. But continuously having an application, because we also have anonymous communities where if a mom may be thinking that there's something wrong and we've asked her that question, they're engaging in that platform and they're talking to other mothers and potentially
Right.
getting the help that they may not have gotten otherwise. So to me, those are success stories, and we've gotten the opportunity to work with additional counties within the state, and that's also now echoing among other communities and also states. And so I think now we get to test that with our maternal care platform, which we're really excited about. Yeah.
Yeah. I mean, and that sounds like super innovative, kind of that having that persistent, questioning, making sure that the mother is okay. Because, you, like you said, you get the application one time, you're like, I just want to get out of here. Like, no, 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 I'm
No,
good.
yeah.
But then you get it again and again and again, or like reminders, and you have a community where you can also, because sometimes I'll do that too, I'll be like, like, is anyone else feeling this way that I'm feeling? And then it comforts me to know that I'm not alone.
And we're
Um,
anonymizing it because with mothers,
yeah.
we feel like we should do everything. We should champion everything. We're super women. And at that point, when you're anonymizing it, you're like, I am
Yeah.
user number 5529. And you have no idea who I am, but I get to say,
Right.
ask questions.
Right.
And the other piece is when we started before even the community and health plan work, we actually worked with employers. And so we have an entire white paper. You can find it on our website. And it kind of showcases how we've worked the data that we've collected from self-insured employers. So how have we improved musculoskeletal issues? How much cost have we saved in terms like of claims for them, and also NPS scores? So that was kind of our earliest B2B success story. And our D2C success stories are all of our testimonials that are on our website and all in the app stores and everything that you see on social media of just that
Mhm.
was just all organic. They were just finding our application and finding value in
Amazing.
how they were finding in Myri. Yeah.
Yeah, that's amazing. And I know that we are kind of coming close to the time here, so I want to make sure I get to two more questions for you. When you envision the future for maternal health care, how does your company fit into that vision, and what do you foresee happening in the next 5 or 10 years?
So 5 or 10 years, that is, with the state of how we just had a recent election too, right? So things change, but I guess I'll be very, very hopeful. I guess before I jump into the 5 to 10 years, I feel like in maternal care and how does my company fit into it is the future of maternal care is going to have to be personalized, equitable, and it's gonna have to be proactive because we can't keep putting a band-aid on something and being reactive. So this is where every mother, regardless of her geography, her income, her background, has the access to tools to support an education and thrive. And so technology-driven personalization, we're leveraging AI and predictive analytics, accessibility and equitable care, and really holistic support beyond birth. Like I always talk about the fourth trimester, it's always forgotten. And so mental health support, pelvic floor therapy, ongoing education, and then the preventative and efficient care models, right? So, you know, employers, health plans, municipalities, everyone's embracing a maternal health care solution that's going to emphasize reducing complications and improving outcomes and lowering costs. And then being culturally competent, I think that is how I envision the future of maternal care, where we respect the diverse needs and traditions of mothers with various
Absolutely.
backgrounds. And so I think that's how I envision the future of maternal, like of maternal care. And I feel like when it comes down to even 5 to 10 years, I feel like the digital health solutions have a potential to be a really big equalizer in maternal
Yeah.
care, especially the populations that are at risk, because that ends up breaking down barriers for distance, cost, race, resource
Right.
limitations, and you're giving high quality care that's accessible to moms that could have otherwise been overlooked. So
Absolutely.
us fitting in, I feel like we're kind of fitting the bill and moving the needle on a lot of these. Aren't doing all of them perfectly right now because we're so early stage, but we're fitting in by providing personalized care plans and assessments. We have a hybrid cloud infrastructure that allows us to connect mothers to virtual support, to resources. We're really trying to meet the mom where she is, and then us just in a high level being able to bridge that gap of truly meeting the mom where
Absolutely.
she is and the provider. Yeah.
Absolutely. And I wanted to ask you this last question is what is your ultimate goal for your company in terms of the overall impact in the broader healthcare ecosystem? I know you kind of mentioned it, but if you had a kind of one ultimate goal, what would that be?
I think it would be to fundamentally reshape maternal health care I know I've beat this dead horse, but by being proactive and making it personalized, equitable care the norm. We can't provide solutions to mothers that are just one size fits all. It can't be just a piece of paper. Like there are so many moving pieces within our own bodies, how we sleep, how we eat, what our family history is like. We want to make sure that every mother, regardless of where she lives, her circumstances, is supported, empowered, and cared for from conception and beyond. And in the short term, that means reducing these complications and improving outcomes and really closing the gaps in care.
Absolutely. Well, thank you so much. I know we're at time today. Time always flies by so quickly when you're having these conversations. I just want to let everybody know if you want to connect more with Dr. Pinkey, her LinkedIn is in the chat. You can check out more about all the great work that she's doing. Thank you so much, Dr. Pinkey, for your time today. It was truly a really great discussion, and I'm looking forward to hearing more from you in the future.
Thank you so much for this. I appreciated being here.
Absolutely. And I just wanted to remind everybody to join us next week for our next session for Women's Health Tech Wednesday. Also wanted to thank all of our sponsors for sponsoring this so we can continue to do these wonderful episodes and have great speakers like Dr. Pinkey. And of course, one more huge thank you to Dr. Pinkey for your time today and sharing us all about your expertise and again, your wealth of experience. Thanks everybody for attending and I'll see you next week. Bye-bye.
Thank you. Bye.